Hello, my name is Wally with Clarify Medical Professional Services. This is a quick tutorial on collecting specimens for PCR testing. PCR testing is a new and exciting replacement for standard cultures, as it provides accurate results more quickly. Reports are typically available within 24 hours of the specimen's arrival at the lab. The lab report will show the pathogens that are present, their relative numbers, any antibiotic resistance genes that these pathogens have acquired, and a chart of recommended antibiotics. To collect and prepare a sample, you will need 3 items: a pathogen sample chain of custody form, or CCF, labels, and one of 2 types of pathogen collection kit. The first pathogen collection kit with a cup is for UTI, urogenital, and respiratory tests. The second kit is for open wound, gastrointestinal, and nail or perinechial infections. The common items present in both kits are 1 or 2 swabs for specimen collection, a specimen tube used for sample stabilization and transport, and a sample bag in which to store and transport the tube and the associated CCF. For each collection, the swab should be placed into the tube, the swab handle broken off at the indentation, and the lid securely tightened on the tube. The tip of the swab should be submerged in the medium at the bottom of the tube. This medium will lyse any pathogens that are present and will stabilize the sample for transport to the lab. After collection, the tube should be labeled, and it should be placed in a location where it can remain upright for 10 to 15 minutes, but no refrigeration is necessary. The pathogen sample chain of custody form, or CCF, is quick and simple to fill out. To receive information about antibiotic resistance on your report, make sure you mark this box. Document the patient's last name, first name, gender, and date of birth, as well as the date and time of collection. As the collector, write your name in the space provided. Check the box for the test that will be performed. And don't forget to check the box for antibiotic resistance. This will provide you with information on the antibiotics that will be most effective against the pathogen. When a patient becomes symptomatic, these are the steps you will follow to collect a sample. Using this to diagnose UTIs may be the most exciting function of this test. When collecting a sample to test for a UTI, be sure to use a kit with a cup. Although this test is much less sensitive to false positives due to contamination, use the most sterile collection methods possible. For catheterized patients, follow the instructions in our collection instructions packet. To swab the sample, place the tip of the swab in the cup and rub the tip in 1 complete circle before placing it into the tube. Break off the swab handle at the indentation and leave it in the tube. Screw the lid on the tube and tighten. Place a label on the tube, and make sure the tube remains upright for 10 to 15 minutes. Place the tube into the sealable bag, and place the properly filled out CCF into the outside pocket. To collect a sample from the patient's nasopharynx, insert the swab into the nasal passage, parallel to the palate, until resistance is encountered. This is typically the distance between the patient's nostril and ear. Rotate the swab 5 to 10 times to thoroughly swab the area. Place the swab into the tube and break it off at the indentation and leave it inside the tube. Next, use the provided cup to collect a sputum sample. Have the patient breathe deeply 3 times, cough, and then spit phlegm into the cup. Swirl the swab in the specimen 4 or 5 times, place the swab into the same tube as the nasal swab, and break it off at the indentation. If both methods of collection are done, send both swabs in the same tube. If the patient can only provide either the nasal swab or the sputum specimen, the sample can still be tested, but both are preferred. Place the tube into the sealable bag and place the properly filled out CCF into the outside pocket. The urogenital test can be easily used to test for most sexually transmitted infections. Be aware that some bloodborne infections, such as HIV, should be diagnosed by a separate blood test. If the only sample you are collecting is a urine sample, use the collection kit with the sterile cup. For best results, collect a sample from the patient 2 or more hours since their most recent urination. Swirl 2 swabs 10 to 15 times in the cup, place both swabs in the tube, and break them off at their indentations. Screw the lid on the tube and tighten. Place a label on the tube and make sure the tube remains upright for 10 to 15 minutes. Place the tube into the sealable bag and place the properly filled out CCF into the outside pocket. Use the sample collection method that is appropriate to your patient. For a complete description of these methods, including various swabbing locations and techniques, please refer to our collection instructions packet. The GI test can be used to diagnose most common gastrointestinal infections, including C. diff infections. For the GI test, utilize the swab to collect the specimen in one of 2 ways. To collect from a recent stool sample, insert the tip of the swab into the sample and rotate 5 times before placing the swab into the tube. Or, for sample collection from the rectum, insert the swab about 1 inch and rotate 5 to 10 times in an anal pocket or groove. Place the swab into the tube, then break it off at the indentation. Screw the lid on the tube and tighten. Place a label on the tube and make sure the tube remains upright for 10 to 15 minutes. Place the tube into the sealable bag and place the properly filled out CCF into the outside pocket. To collect a sample from an open wound, place the swab in and around the wound to obtain some of the pus. Place the swab into the tube and break it off at the indentation. Screw the lid on the tube and tighten. Place a label on the tube and make sure the tube remains upright for 10 to 15 minutes. Place the tube into the sealable bag and place the properly filled out CCF into the outside pocket. The nail infection test requires a swab from the nail bed, as well as a small clipping of the actual nail. Place nail trimmings into the tube along with the nail bed swab and break off the swab at the indentation. Screw the lid on the tube and tighten. Place a label on the tube and make sure the tube remains upright for 10 to 15 minutes. Place the tube into the sealable bag and place the properly filled out CCF into the outside pocket. For more specific instructions, please refer to the collection procedure packet we have supplied, or contact one of our representatives to obtain this packet. If your facility is not yet set up to perform these tests, or to refer us to a colleague who would benefit from these tests, please call 801-404-8721. If you are already set up and would like to schedule a sample pickup, please send a text to 801-940-0575.